Warm welcome to this talk. Now, I've had innumerable requests to respond to this talk here. This is between Tucker Carlson, of course, and Dr. Patrick Soon-Shiong. Now, Dr. Soon-Shiong is a very experienced surgeon, medical researcher and entrepreneur with 50 years experience. So there's a lot to learn from him. And the reason I'm wanting to do this, as well as all the requests, was it rings true with what I'm being told by doctors in the United Kingdom. It sounds like doctors in the United States are seeing the same thing. So I'm going to do a quick review of the first part of this video as I understand it. So Tucker started off by saying, look, we were told smoking causes cancer, and make no mistake, it does. Smoking is a big factor in many cancers, not just lung cancer, but bladder cancer, pancreatic cancer, other cancers as well. But smoking has gone down dramatically now. It's only about 15% of people in the UK ever smoke now, although we have these wretched vape things, but they're slightly different concern. So smoking's down, but cancer rates are up. What the heck? You know, if smoking was one of the main causes of cancer, we should expect cancer rates to be down, because smoking rates are way down, but cancer rates are up. That's strange. And Dr. Soon-Shiong is seeing more cancers in younger people. And he mentioned the cancers he's seeing particularly in younger people. Cancer of the pancreas, top of the abdomen, ovaries in women, of course, and colon, the large bowel, seeing these particularly. And pancreatic cancer especially, he talks about as having a remarkably poor prognosis. Now, pancreatic cancer is associated with increasing age, it's associated with smoking, and it's associated with chronic pancreatitis. It's way more common in the over 70s. I have seen it in patients in their 60s, but that's less usual. It's associated with older age. Only a few percent, maybe 5–10%, have got some genetic component. The survival rate for pancreatic cancer is appalling at the best of times. Locally advanced disease, 6 to 10 months survival time. Metastatic disease, you're looking at 3 to 5 months survival time. These patients get diagnosed and die alarmingly quickly. Most of them are what are called adenocarcinomas. These are in the glandular tissue. About 90% are glandular cancers. That's why we call them adenocarcinomas. They're in the glandular tissue. Very painful condition associated with weight loss. And sometimes, especially if the tumour is near the head of the pancreas, it blocks the bile ducts and the patients go a bright jaundice colour, a bright yellow colour. I remember the first time I saw someone with advanced CA head of the pancreas, carcinoma head of the pancreas. I couldn't believe how yellow they were. Incredibly yellow. And of course, that's very uncomfortable, very itchy. Anyway, Dr. Soon-Shiong is a very experienced pancreatic surgeon. He's done transplants. I think he did the first whole pancreas transplant, and he's done a lot of work putting in insulin-producing cells and the islets of Langerhans cells that produce insulin. Very experienced in that field. And in all the time he worked in the field, he never saw pancreatic cancer in children. Never. And it's unheard of. Now, I've talked, since I've started watching this video myself a few days ago, a week ago, I've talked to quite a few very experienced doctors, and none of them have seen pancreatic cancer in children and not in young people. Most doctors I've talked to haven't seen pancreatic cancer in people under the age of about 60. You might get the odd case in the 50s, but it's a condition of older people. And Dr. Soon-Shiong has seen a case was referred to him in a 13-year-old. 3 years older than 10. The centre had been treated at, they tried everything. He was referred to him with advanced metastatic pancreatic cancer at the age of 13. Sadly, the child died. If you're a doctor, let me know if you've ever seen this before, because none of the doctors, I've certainly never seen it before, but I've not got massive experience in oncology. But none of the highly experienced doctors I've talked to have seen this before. And I'm talking about doctors with 40 years plus experience, simply haven't seen it. This is new. Something new is happening. He's also seeing it in 40 to 45-year-olds. And this has been described as a non-infectious pandemic of cancers. So we've had a pandemic of an infectious disease. Now we seem to be getting a pandemic of non-infectious disease. Cancer is usually a non-infectious disease. Colleagues of Dr. Soon-Shiong have seen colon cancer, and again, colon cancer, again, associated with older age groups. Now, we do get colon cancer sometimes as a result of genetic abnormality in people in their 30s, 40s, even 20s, tragically. It does happen. But typically that's due to some specific genetic abnormality. Colleagues of Dr. Soon-Shiong are seeing cancers in 8, 10 and 11-year-olds. Again, this is just unheard of. 8, 10 and 11-year-old children developing colon cancer. They're seeing a lot of women in their 30s and 40s with ovarian cancers. And he used the term turbo cancers. Tucker asks, are we seeing cancers that are more aggressive, more virulent, higher stage cancers? And yeah, we're seeing more of these turbo cancers. They're presenting with a more virulent form of malignant cell. And these are spreading and causing death more quickly, higher grade malignancies. And also people that are in remission of cancer have been getting the cancers back. And we talked about this with Professor Dalgleish. Oh, Professor Dalgleish has noticed this for a long, long time, but I first learned about this from about a year ago. Professor Dalgleish noticed that people that had booster vaccines, very often cancers that were in remission, that had been basically dormant for 5, 10, 15 years, were being reactivated. Now, in this first part, that's not talked about vaccines, but other doctors I've talked to have seen this. And other surgeons we've talked to on this channel as well. Now, it then goes on to talk about cancer cells. Now, killer cells. So basically, we're all getting cancer every day. We live with cancer. People get cancer every day. But hopefully the killer cells come along and kill it. They recognize it. These killer cells, cytotoxic T cells, type of T lymphocytes, white blood cells, another group of lymphocytes called natural killer cells. If a cell is infected with a virus, then that virus will put abnormal proteins onto the cell surface. And the immune system, the T killer cells especially, they'll just see it and they'll whack it, they'll kill it, which is great. Virally infected cells are killed, and that means the viruses can't replicate inside the cells and spread to, if you don't get viral replication, you don't get other cells infected. Same with cancer cells. There's something abnormal about the chemistry in cancer cells that the immune system can recognize, and they will kill it. But there's a balance between killer cells and suppressor cells. So to get cancer cells, the killer cells need to be inhibited so the cancer cells aren't being killed. And the suppressor cells that normally damp down the killer cells, they're activated. So what we're getting now is not enough activity in killer cells and too much activity in suppressor or regulatory cells. In other words, immunosuppression. These cancers seem to be arising as a result of changes in the immune system, immunosuppressor cells. So natural killer cells and cytotoxic cells are supposed to recognize infected cells. They're not recognizing them. And Dr. Soon-Shiong calls the natural killer cells the first responders to kill cancer cells. But if they're not activated, or if they're oversuppressed by too much activity of the suppressor cells, then the cancer cells are just carrying on dividing. So are the tumour cells hiding from the natural killer cells, the T killer cells? Are the T killer cells down-regulated? Are the suppressor cells too up-regulated? It's something to do with this. He describes it as a yin and yang, a balance. There needs to be a balance, and we're out of balance. That's what seems to be causing these cancers, especially in younger people. Now, if suppressor or the regulatory cells are enhanced, again, immunity is going to be reduced. And immunity, we usually think about immunity as protection against infection. Of course it is, but immunity is also protection against cancer. The best thing you can do to prevent cancer is to upregulate your immune system. So to treat cancers, we need to increase the T cytotoxic cells, the killer cells, and reduce the activity of the regulator cells. And he says there's a problem here, that there's a lack of immunologists in cancer. Now, coincidentally, we had a long conversation with Professor Clancy, Professor of Immunology, of course, on this very topic yesterday. So do try and watch that video. Very, very enlightening. So lack of immunologists. So cancer doctors often aren't quite realising of course, they're clever doctors, but we need more on the immunology, because there seems to be an immune deficit and immunosuppression at the moment, which is leading to these increased numbers of cancers. And cancer, Dr. Soon-Shiong said, is everything about immunity. Pretty strong word for a doctor. Everything about immunity, because we get cancer every day. So now a lot of people are out of equilibrium. Their immune system is out of equilibrium. Is this due to ultra-processed foods? Is it due to infections? It's certainly as a result of chronic inflammation. So this is a key thing. Chronic inflammation will very often lead to cancer. Chronic inflammation will very often lead to cancer. What is there in our environment that could be leading to chronic inflammation? Ultra-processed foods could, of course. Infections could be. Abnormal immune reactions could be. Ongoing production of particular pathogenic proteins could be leading to chronic inflammation. I'm being careful not to put words in Dr. Soon-Shiong's mouth here. I'm just trying to restrict myself to what they actually said. But that's the key thing. Chronic inflammation causes cancer. No question about that. And with prolonged inflammation, the neutrophils. So neutrophils are cells which eat bacteria. They're sometimes called macrophages. They're phagocytic cells. They will eat. They're antibacterial cells. So when you have a bacterial infection, your neutrophils will go up. You'll get more neutrophils. But he said this, and I didn't know this. I had no idea about this. But he said with prolonged inflammation, the neutrophils can go from cells that eat bacteria. They can flip. In other words, they can transform into suppressor cells. So if there's prolonged inflammation, the very cells that are there to combat the inflammation, well, not to combat the inflammation, but to eat the bacteria that are causing the inflammation, the chronic inflammation can cause these to flip into suppressor cells. And he calls this, again, this is this yin and yang idea. So for every cell, there's sort of an equal and opposite cell to give this equilibrium. It's kind of a seesaw, isn't it? He talks about a yin and yang. And he talks about a term he's invented here called quantum oncotherapeutics. Now, what the heck does that mean? Well, onco, of course, is cancer. ONCO, cancer. Therapeutics is to treat cancer. Now, quantum is the idea. This goes to sort of Schrodinger's cat, because apologies to quantum physicists, but quantum particles can exist in two states simultaneously. It doesn't make any sense. That's the whole point about quantum physics. It doesn't make sense. So the idea is that Schrodinger, famous physicist, expanded up from a particle to a cat, and he said if you have a box with a cat in, that cat can be both dead and alive at the same time. That's the paradox. So what he's talking about is these cells. What he means is there's particular cells, and the cells can be in two states or change from one state to the other. So a cell like the neutrophils, which were protecting us, can flip into another state, into a suppressor cell. That's what he means by quantum orthotherapeutics, that a cell can be in two states. Not at the same time, but it can change quickly, and probably change quickly within a few hours. So cells in two types of cells. We talked about killer cells, suppressor cells. For each cell, there's an equal and opposite cell. That's how we keep in equilibrium. That's how so we want to be in equilibrium. We want to kill cancers. We want to kill infections, but we don't want to be reacting to every pollen grain that we come across, or every foreign protein. We don't want to be reacting to peanuts all the time. We need this balance. And he gave an example here. M1 macrophages will eat. So macro, big cells. Phage means to eat. The big cells, the macrophages that are derived from monocytes in the blood, they will eat, but they can be converted into M2 macrophages, which will suppress or block this response. So all these natural yin and yang, seesaw effects in the body are supposed to be in equilibrium. At the moment, in a lot of people, they seem to be knocked out of equilibrium. That's what this conversation is about, as far as I understand it, as far as we've got. And he also talks about quantum entanglement. Again, this is a quantum idea. So quantum entanglement is where, again, I'm not a physicist, but it's where one particle does something, another particle somewhere else will do the same thing at the same time, even though there's no physical connection between them, and they could be hundreds or indeed millions of miles apart. And anyway, the quantum entanglement is this idea that there's an entanglement between the killer cells and the suppressor cells, and that they can change from one to the other within minutes. This can be very quick. So he says there's a need to understand cancer cells in more detail, because cancer treatments at the moment, and I've never thought about it in these terms, but it's very interesting. He said cancer treatments, we've got surgery, radiation, chemotherapy. He said all of these things aren't wrong, but he said they're not enlightened therapies. They're all aimed at attacking suppressor cells, not enhancing the T cytotoxic cells. And then the conversation goes on to virally induced cancers. But clearly chronic inflammation and viruses are a known cause of cancer. Now, this brings us on to the development by Professor Dalgleish, where he's got a vaccine, or he's used a vaccine that is developed with others. He's trialled it. It's based on basically a bacteria from cows, Mycoplasma vaccae, and this it's just not subcutaneous, intradermal injection, which will upregulate the T cells. If you upregulate the T cells, what's that going to do to your cancer cells? Well, if you upregulate the T cells can kill the cancer cells. If you upregulate the T cells can kill the bacterially and virally, kill the bacteria and kill the virally infected cells. Thoroughly good thing. So he's got this. He's kept oncology patients alive for ages with it. Incredibly, some of his stories are quite amazing. How he's kept people alive for so long with this. He went to the Medicines and Healthcare Products Regulatory Agency in the UK. Said, this is being used now, it's safe, it's effective. Will you please license this for therapy, for therapeutic use, so that doctors can prescribe it compassionately? And Medicines and Healthcare Products Regulatory Agency refused his application. So there is a treatment that will upgrade upgrade T cytotoxic cells, that will kill virally infected cells and probably kill a lot of cancers as well, but we're not allowed it. And I want that vaccine, but I'm not allowed it, and I think that's outrageous. Anyway, that was the first part of the interview there, just nearly all based on the conversation between Tucker and Dr. Patrick Soon-Shiong, just with a few extra minor thoughts from me, but I've tried not to stray too far from what they've said. That's just the first part of the conversation. I'm going to look at the next part as well later. I didn't want to do too much now for two reasons. One, if I do too much, I'll start forgetting it myself, and the other thing is it'll just be too long for one video. But that was the first part. There seems to be an outbreak of immunosuppression, so there's been perturbations of the immune systems that are leading to these aggressive turbo cancers, often in young people. I know you're screaming out for answers. What happened in the lives of these people before the cancers developed? Well, that information is not collected very much in the UK. Hopefully, it will start to be collected now in the United States. So we might be soon in a position in the United States where we can make correlations between, I don't know, maybe a particular therapeutic intervention that these young people had, maybe in 2021, for example, or 2022, and to cancer that's developing now in 2024, 2025. I know you're screaming out for answers on that. This interview can't give those at the moment. We can only give what you can. But we're hopeful that this data will be made publicly available so we can work out what the heck is going on. That's the review of the first part. Thank you for watching.